Okay, so today we're here with Dr. Austin Daus. Austin is a physical therapist working in Phoenix, Arizona. For undergrad, he studied physiology at the University of Arizona, and he graduated with a bachelor's degree. From then, he went on to become a doctor of physical therapy at the University of Southern California, where he graduated in 2019. Simultaneous to that, he got his certified strength and conditioning coach uh, license, degree, specialty. And after that, he's gone on to work in Phoenix, Arizona, where he currently works at Spooner Physical Therapy. So, Austin, will you tell us a little bit about your clinical practice and the clinic that you work at?
Yeah, of course. Thanks, Scott. Um, yeah, so like Scott said, we're here in Phoenix, Arizona. We have a 20,000 square foot facility behind me here. We deal with pretty much every patient population under the sun. I mean, literally ranging from as young as I think 9 years old, all the way, 9-year-old athlete, all the way up to high school athletes, general motor vehicle accidents, college athletes, professional athletes, all the way up to total joint replacements and stuff like that. So we see definitely a wide spectrum of patients here, which is super cool for us. We do get the luxury and the benefit of getting to see professional athletes, NBA, WNBA, MLB, NFL, U.S. National team women's soccer, Korean baseball, Japanese baseball. So we see pretty much everything from all over the world. It's a pretty special opportunity to be here. Yeah.
Now, is it true that you guys participate or take guys in preparing for the NFL Combine? And can you tell us a little bit about kind of the yearly flow of professional sports athletes through the clinics?
Yeah, so we traditionally have actually, yes, we have done the combine training for, college athletes that are now leaving college and looking to enter the combine, get drafted, start their next, page of life. This past year, I think just COVID and just the difficulties that maybe surrounded that and doing a combine training and clinic, policies and stuff like that. We actually didn't do one this past year. But typically, I guess what our flow looks like is usually the off season. So baseball is pretty much, if you make it to the World Series end of October, if not, usually a little bit like beginning October. So pretty much October to about mid-February is when our baseball guys are in. Football guys are a little bit later, so those guys are usually obviously playoffs, Super Bowl being around January, February. So usually around that time to about May-ish. And then they have to report for kind of a mini camp kind of thing. And then they usually come back for a couple months during the summer if they're not trying to take advantage of their time and go on vacation. So we have a couple guys right now, and then they all leave again in come August for camp and whatnot. So then most of those guys are gone for the season. We do get a handful of guys that come in from wherever, whatever sport throughout their season as well. Usually, typically, that's like more of a long-term injury, ACL rehab, Achilles, rupture repair, things like that. Like if you just have, bumps and bruises kind of thing, you're usually sticking with the team for that. But we do get the occasional guy that comes in and spend some time with us during their actual season as well. So.
Now, what does the ideal patient population for you look like? Like, if you got to choose who you would treat all day long, who would you be seeing, and what sports would they be playing?
It's a good question, man. Yeah, I think all sports kind of have their nuances to them and stuff. But I grew up kind of a baseball fan and stuff, so I played baseball growing up. So ideally, I love treating baseball, but I certainly do love treating football and basketball, and it's all good stuff to me. But I again, kind of touching on earlier, I think the special thing about Fisher is that we do get to see kind of the whole thing, so my 7 o'clock could be, total knee replacement. My 7:30 could be, professional football player. My 8 o'clock could be 9-year-old hockey player. So it's a pretty special opportunity to be able to see that spectrum. But I am true and behold a baseball fan. So.
Now, of course, I asked you to come on to the conversation to speak a little bit about your thoughts on the NecksLevel device. And can you just speak a little bit about the neck pain population, if you guys are seeing that at your clinic, and a little bit, if you have a broad view of neck pain rehab for how you treated before the NecksLevel device, and now if it's changed at all since adopting that.
Yeah. So for me, and just in general, so any type of neck pain injury, whether that's, postural related, post car accident, concussion, whatever it may be. I think prior to, it was your traditional, chin tucks. Let's work on maybe some passive range of motion on the table, but other than that, it's like get them up and try to, maybe get them into a better posture, scap stability, that kind of stuff. But I do believe now that we've had the NecksLevel, it allows us to kind of take a step back and almost kind of build that foundation from where maybe like that actual true source is, where the true source of the problem is, So, you get the benefit of obviously being able to do, nice free flowing active range of motion. You can get isometrics, you can get concentric, you can get eccentric. So I think it allows us to really hack into it and actually, there's a million shoulder exercises, right? But I think before this, there's not really a whole lot of neck exercises per se, but I think this thing actually allows us to, add to that library of neck exercises, which has been fun and interesting to see. And I think patients really enjoy it. And I think the ease of it is a big draw for a lot of patients too.
Now, yeah, what have you specifically heard from your patients about it? Can you talk a little bit about their experience using the NecksLevel?
Yeah. So again, I think one of the things is the overall just like free flow of the device. It's not, sometimes you get something that's kind of sticky while you're trying to rotate it or move it or glide it or slide it. I feel like this one, it's just really free flowing. And then the other thing is I feel like the resistance cords on it give it a consistent feedback. So for example, like we have, it was actually literally yesterday, I overheard a patient say, we have this exercise we do here. It's called cervical spine slides. So chin tuck, take your hand out, put it back, or take it out behind your head, put it back in, try to maintain, deep neck flexor endurance, right? And then he was struggling with that. So then we put him on the NecksLevel. It wasn't my patient, it was someone else. So someone else then put him on the NecksLevel, and then he did whatever. I can't remember what exercise it was, but then he got up. He was like, wow, that actually felt a lot better. Like it was a little more smooth and easy, and like not easy, but like more free flowing, not as strenuous, and like it felt more specific kind of thing. So I thought I was like, oh, well, perfect. That's a perfect testimonial for tomorrow. So yeah.
And then I remember you texted me one time that you had a patient who, she didn't have a lot of time in the clinic that day. And then what did she end up saying?
Yeah, she was short on time. She came in for a little bit of manual treatment, and then she was like, hey, I don't have much time for exercise, but can I just knock out the little rotation device thing? And I'm like, yeah, perfect, let's go. And then I text Scott. I was like, hey buddy, your device is getting some pull, so it's good. So yeah.
Very good. Now, can you speak a little bit about how you use the device? So, your favorite exercises, if you have like a general routine that you work most of your patients through, where, maybe you start with range of motion and work up to strength, or anything that you do consistently across the board?
Yeah, I would say pretty consistently, I start most people on definitely the active range of motion. So no resistance, just trying to go back and forth and, increase kind of neuromotor control and just introduce these joints to some new range of motion. And then I think secondly, what I also always try to do is the isometrics. So the rotation isometrics. So, lift your head up, push it to one side, put your head down, and then hold it kind of thing. For me, and even just testing it out myself, I feel like it just wakes everything up, and I feel like patients have kind of had some good responses with it and stuff. And nobody usually has any pain with it, which is good too. So again, I think with a lot of neck pain and stuff like that, it's just reintroducing people back, saying, hey, you can actually move without neck pain. And I feel like this device kind of helps promote that. And then in terms of then progressing from there, then obviously it's just progressing to the concentrics and eccentrics of working with the next level, and obviously increase resistance as we see fit and whatnot. So
what are the other physical therapists and athletic trainers there saying about it? Like I know you use it, but are other people using it as well?
Yeah, absolutely, 100%. Pretty sure everybody has a patient, at least one patient right now, that is using it. Yeah. And then I know we had talked a couple months ago on the the little demonstration you did for our clinic and whatnot, using it for table slides and stuff. So I actually had it's been a couple months. He's way progressed now, but I had a post-op rotator cuff, and we actually used that for some of his table slides. And I don't know. I think it's nice just because, again, it's reduces that amount of friction with the table, and yeah, pretty effective in that sense as well.
Very good. Very good. Well, is there anything else you want to say about the NecksLevel device, and anything that pops into your head that I have not sufficiently illuminated?
Yeah, no, I mean, just to kind of rehash everything, I feel like it's just a versatile product in the sense that it's just, like I said, there's a million shoulder exercises, there's a million knee exercises, but I really don't feel like that library for neck exercises has really been tapped into. So I feel like this thing actually offers all of the typical strength, endurance protocols and parameters that we all know and have learned through school and training and stuff. So I think it's cool and fun to see this as well. Being able to tap into all of that, it's been cool to see, and patients, I feel like they love it. And yeah, we're just going to keep using it and keep seeing how we can create new things and new opportunities with it.
Very good. Now, I remember we once met up at the combined sections meeting, the big PT annual conference, and you requested a cervical manipulation. So perhaps you have a little bit of neck pain yourself. Have you ever tried it out?
Yeah, no, absolutely. Anytime. I probably should be more consistent with it, but just life gets away from you and stuff like that. But spend a lot of time looking over at patients and stuff like that. And all of our professors back at SC would probably be hating me right now for body mechanics, but we don't have the fortunate benefit of having too many high-low tables. So I spend a lot of time looking over at patients and stuff. So I definitely, there's some weeks more than others where I feel some of that, neck pain and whatnot. And the NecksLevel active range of motion and the ISOs. And then I even do the little incline chin tuck kind of thing. Ends up being something I try to do at the end of the day as much as I can, or at least before I work out, kind of in the morning as well, just to, again, the rest from top down kind of thing. So.
Well, very good. It's an honor to have you here, and great to catch up with you. So thank you.
Yeah, of course, Scotty.